clinical condition, in that case, Doppler can help you for the diagnosis of that condition. Polyp. Endometrial polyps account for abnormal uterine bleeding in 39% of premenopausal women and 21 to 28% of postmenopausal women. 2D ultrasound with CIS, that is saline infusion sonography, and 3D uterus with CIS confirmed endometrial polyp. Color Doppler reveals pedicle artery sign confirming a large polyp which has positive predictive value of 100%. That is, feeding vessel is very important. Now, adenomyosis, grayscale ultrasound shows asymmetric enlargement of the uterus. All of you know, myometrial cyst, rain in the forest appearance with obstruction of the endomyometrial junction. Color Doppler reveals an increased number of penetrating tortuous vessels throughout the involved myometrium. Adenomyoma, morphologically it defined lesions with mixed echogenicity, no mass effect, no calcification is found in the adenoma. Color Doppler reveals trans-lesion vascularity. It is mostly absent in case of fibroid, but in case of adenomyosis, we find the vascularity. Now, leiomyoma. Leiomyoma has well-defined margin, will have mass effect. Calcification can seen when closely related to endometrium, leads to displacement of the junctional zone. That is, it may displace. Color Doppler shows striking vessels along the periphery of the lesion without lesion vascularity. This helps in, that is, vascularity around the fibroid. This helps in better definition of the size and location of the lesion, extent of myometrial involvement. Color Doppler helps in identifying the predominant site of the supply, site with lower RI and higher peak systolic velocity and end diastolic velocity. Morphologically, they have features like leiomyoma. Color Doppler reveals intertumoral vessels. Intertumoral vessels have decreased RI and PI, increased peak systolic velocity. That is, peak systolic velocity is always angle dependent, but RI and PI not angle dependent. Leiomyosarcoma. Morphologically, they have features like leiomyoma. Color Doppler reveals intertumoral vessels, but we find in case of leiomyoma, there is no vascularity in the fibroid. But in case of leiomyosarcoma, color Doppler helps us for the visualization of the vascularity. Intertumoral vessels have decreased RI and PI with increased peak systolic velocity. All of you know, in case of tumorous condition, there is partial lacking of the muscular coat of the vessel. For this reason, there is less elasticity of the vessel. Due to less elasticity of the vessel, there will be more blood flow, that is less impedance. Now, endometrial carcinoma. Endometrial abnormalities are categorized based upon quantitative assessment of the endometrial thickness, quantitative assessment of the endometrium, morphology, and echogenicity. Endometrial midline echo, very important. Endometrial endomyometrial junction. Color and Color Doppler assess the vascular pattern. Color Doppler score. Color score 1 to 4. Color score 1, no color. Color score 2, minimal color. Color score 3, moderate color. And color score 4, abundant vascularity. There is lot of vessel, a lot of vascularity in the color scores group. Look at this. First one, it is no color, gradually increased color, and abundant color. That is 1, 2, 3, and 4. Vascular pattern, single dominant vessel without branching. Branching is very important. Single dominant vessel with branching, multiple dominant vessels, focal origin, multiple dominant vessel, multifocal, scattered, circular flow, irregular branching, and color splash. It indicates the color spool of the organ. Look at this. There are changes according to the spool of the organ. Pedicle artery sign, that is feeding vessel sign. It is a polyp. If it is a polyp, there will be a feeding vessel. But in case of fibroid, vascularity around the fibroid. Other features of cancer: endometrial thickness more than 5 mm, hypo or mixed epigenic endometrium, irregular interrupted endomyometrial interface, multiple densely packed, large, irregular branching vessels, high color spooling, saline intrusion sonography showing irregular surface of the endometrium. This is a flow chart. Simple endometrial biopsy. If failed, sufficient sample, operative hysteroscopy, diagnostic hysteroscopy, then feeding vessel. Grayscale and color Doppler characterizations of the endometrial malignancy. There is changes, there is dilatation of the vessel, there is tortuosity of the vessel. It indicates that there is changes in the endometrium. Adnexal lesion. Adnexal lesion with solid component and demonstrating abnormal vessel is highly suggestive of malignancy. Vascularity of the adnexal lesion is assessed by a subjective method such as number flow 1, minimal flow, moderate flow, strong flow throughout the organ. Number 1, no flow. Number 2, minimal flow. Number 3, moderate flow. And number 4, strong flow throughout the region. Virtual 3D angiographic sampling. If we do B mode or without color Doppler, we can see the complex lesion in the organ. If we put in color, there will be changes. There will be color flow in the organ. According to color flow, we can categorize the angiographic sampling. 3D or Doppler vascular sampling is a promising tool for predicting, that is cancer, that is mass. Now, vessel density. VI vascularity index, FI flow index, VI-FI vascularity flow index. If we put this index, we can easily diagnose the condition of the patient. Color Doppler in active pregnancy. All of you know, implantation and development of the fertilized ovum outside the uterine cavity. It may be mainly fallopian tube, it may be cervical region, it may be previous cesarean scar region. Mostly we find the vascularity due to plastic changes, to plastic vasculation. Look at this, there is changes in the implanted site, that is vascularity increase. Pelvic congestion syndrome. TPS color Doppler provides dynamic information regarding venous flow pattern. Criteria like dilated ovarian veins, more than 4 mm in diameter, dilated tortuous arcuate veins in the myometrium, which communicates with pelvic varicose veins, blood flow less than 3 cm per second. It indicates pelvic vessel congestion. Torsion, that is ovarian torsion. How can we diagnose the ovarian torsion? Absence of flow in the affected ovary. Arterial flow can be demonstrated due to only venous flow compromised. Dual arterial supply to the ovary. Adnexal torsion, that is broad ligament, fallopian tube, ovaries, branches, ovarian branches of the uterine artery and vein. Visualized as round, hyperechoic mass with multiple concentric hypoechoic straps Color Doppler may reveal adnexal torsion. Doppler in infertility. Color Doppler is valuable diagnostic imaging tool in reproductive medicine. It is used in the assessment of the uterine anomalies, intrauterine pathologies, tubal patency, ovarian follicular monitoring, polycystic ovarian disease, ovarian hyperstimulation, assessing endometrial receptivity and male infertility. Color Doppler in infertility, ovarian ovulation. Color Doppler is used. Ovarian ovulation, color Doppler is used to monitor the follicular growth, rupture, and formation of early corpus luteum. There is marked drop in the blood flow, impedance in the intra-ovarian vessels during late follicular and luteal phase. There is sequential increase in follicular ring vascularity from the time of luteinizing surge to its peak and just prior to follicular rupture and formation of the corpus luteum. So, color Doppler can help you in that condition for the diagnosis. Thank you all.